Hello, dear friends and viewers. I am Dr. AM Thirugnanam, Senior Interventional Cardiologist. Today, India is facing very critical and unprecedented medical emergency due to COVID pandemic. This is a very grave and complicated situation which is prevailing in India at present. So very important how to overcome this catastrophic, serious, complicated disease. It is everyone's responsible, and every citizen has their own responsibility other than government. Every citizen should act responsibly and decisively in this moment. Here, why this situation is important? How can we overcome this, the most hazardous, catastrophic situation? Today, I am going to talk briefly about vaccines, the various type of vaccines which is available at presently in the market, world market, the importance of vaccines, vaccine side effects, and how we are going to overcome this dangerous pandemic situation. See, as I said before, now we have the limited options in this moment. Number one is properly wearing the mask in public places and avoiding the gatherings, social gatherings, and try to avoid maximum possible unnecessary travel outside, because everyone should understand, and this fact is not frankly spoken outside. The COVID-19 virus in India is a very dangerous than any other, like a previously mutant COVID virus. This virus spreads ultra fastly and it infects any patients in a second. Previously we came to know that last year 2020 virus, it spread slowly, and moreover because that airborne, everybody knows that infection COVID-19 is airborne, but this new mutant COVID-19 virus spreads very fastly and it affects number of patients. Moreover, this COVID-19 virus new mutant is 60-70% asymptomatic. Patient may have slight fever, mild cold, and loss of sense, loss of taste. These two complaints are major, even with the asymptomatic patient. If anybody has the complaint of, as I said before, mild fever, intermittent fever, mild cough, mild cold, mild myalgia, body pain, a loss of taste, a loss of smell sudden, you need to rush to the hospital and check yourself. If the facility is not available in your area, please kindly move fastly to the facility area where the facilities available, like small towns and diagnostic center. First, get tested yourself, RT-PCR, CT chest, high resolution chest CT, and if possible try to get additional investigations like C-reactive protein and D-dimer. This is sufficient. It is not necessary to spend more more money on investigations and tests, because nowadays the poor people, middle class people, they are suffering because of lack of income and lack of income sources and their savings. Because why? Even middle class people, poor people, they can afford this type of investigation and a test. Immediately go to the diagnostic center, test center, get a RT-PCR, then a chest CT along with C-reactive protein and a D-dimer. These 4 investigations sufficient. And if necessary, if you are a cardiac patient, if you had previously cardiac disease, try to get ECG and echocardiogram. This is very important. Otherwise, if you are normal, if you don't have any diabetes or heart problem, either heart problem before, heart failure or hypertrophic cardiomyopathy, it is not necessary to spend initially. But very basically, first get RT-PCR, chest CT, C-reactive protein and D-dimer. Then based on, then gradually you can get it liver function test and a kidney function test. Because this is the one way we can prevent immediately. Other way, it is important to get vaccination as early as possible. Everyone after 18 years, male or female, everyone should get vaccination, COVID-19 vaccination. In India, we have only 2 brands available at present. Here, the available brands in India are Covishield by Serum Institute of India, Covaxin, Bharat Biotech, and the nasal vaccine they have, Bharat Biotech, that is BBV154. Covishield and Covaxin are freely available in India, but some states and towns, districts, they are having lack of stock at this moment. It is very important to the public, political parties and administrators, executives, try to keep the vaccines, the number of vaccines, at least minimum. If they immunize the patient, if they vaccinate the patient to 50% of the population, at least 50 crores population of Indians, we can avoid maximum number of death as well as the COVID-19 infection in India at present. If not, the infection will go on, the number of infected patients will rise, and this new mutant COVID-19 virus can cause higher mortality than previous old COVID virus. Because this virus, this new mutant virus, during the infected period, incubation period, even after recovered from the COVID-19 infection, patient may develop vascular complications like pulmonary embolism, deep vein thrombosis, arterial thrombosis, major artery thrombosis, cerebral artery thrombosis, cerebral vein thrombosis, and coronary artery thrombosis. These are all expected complications, vascular thrombosis and cardiac thrombosis, even after recovered from COVID-19 infection. In addition to that, patient may develop cardiac arrhythmia because pericarditis, chronic pericarditis, and myocardial damage, acute myocarditis, even post-recovery myocarditis, that can cause arrhythmia, cardiac arrhythmia. Patient may develop cardiac cardiac MI, unstable angina. Because during the time, the COVID infection, patient should be properly treated. Early diagnosis and early treatment can prevent the complication of viral pneumonia, this COVID-19 virus induced pneumonia. Because once the patient develops COVID severe pneumonia and the risk score is CT risk score gets higher value, the patient may need ventilator. Because even the 50% of the ventilated patient, not 50%, because 40% of the ventilated patient with severe organ damage may die during the hospitalization in critical condition. So this is a very important of every treating physicians, pulmonologist and a critical specialist and the citizens responsibility also. Get treated early and don't go for any conventional treatment like taking after confirming COVID infection, taking juices, some herbal medicine or Ayurvedic medicine, some unconventional medicine, unproved medicine. Definitely that will kill the patient. Don't forget it. Rush to the doctor. Suppose even immediately, don't expect that you will get immediately beds nowadays. The present crisis, patients, even critical patients, they were unable to get beds on ICU beds in India. How to overcome these complications? This is a very simple. First, if you are confirmed with the COVID-19 infection, if you are mildly symptomatic, consult any physician, your own physician, or you can go to any new physician with the fresh appointments, get the basic investigation, CT chest, C-reactive protein, RT-PCR, a basic ECG, echocardiogram, D-dimer. Based on this, like initial evaluation of major organs, if you get treated with proper antiviral in the early stage, you will not go into ventilator stage or critical condition. Your oxygen saturation will not go down. You will not have any serious complication like shortness of breath, cardiogenic shock, lungs failure, something, or vascular complications. So this is important. Don't forget to get diagnosed in the early stage. Even mild fever, mild cough, which can be even before 2-3 years back, it can be very simple, you can neglect it. But at this present scenario, even mild cough, low grade fever, mild uneasiness, headache, a little loss of smell and taste, don't delay. Rush to your hospital or own doctor, not the hospital, for the small complaint. And if you are affordable to get admitted, to pay for the admission, but don't go to the hospital, because poor people, needy people, they need real hospital administration, ICU admission. Those type of patients are not getting in timing admission in the hospital. So that is the reason, if you take care in the early stage, if you get treated in the early stage with the proper antiviral and medications, you will not get complication and you will not die. Your life is safe. If you don't do all these steps, definitely you may need complications. Because we have 130 crores population. 130 crores, at present our infected, approximately infected population almost nearly 15 to 20 crores. I mean, the numbers may not be correct, but reliable sources. I'm not sure about the numbers, but reliable sources, the maximum number of patients getting treated and the higher mortality nowadays we are facing for the last 1 week. Patients are even critically ill patients, they are not able to get the beds, ICU, hospital admission in time. To avoid all, to allow the critically ill patient to get admitted in the hospital, every citizen, even normal citizen or infected mildly symptomatic patients, every citizen has their responsibility to take care of their own health and your relatives and neighbors. If you are infected, don't roam outside. Quarantine yourself. Consult your physician. If you are not able to get a consultation to the office of your physician, get online consultation. Lot of physicians are available in the online platform. Just to follow their advice strictly. By that way, you can save your life, you can save your money, you can help our government, you can help our present crisis. We can overcome easily from this moment. But this moment, this situation will not continue. But in the May, up to May 30, 31st, it may be higher. After that, the vulnerability and the spreading of infection will come down. But even after that, we have the responsibility to take care of ourselves, and everyone has a responsibility to cooperate with the government and the local administration. Because we have the different, as I said before, we have different vaccines. different countries are producing different vaccines. Very particularly, the Pfizer is producing BioNTech vaccines, which is available in US only, and that Pfizer company US, they are exporting to other countries. Likewise, Moderna vaccine from the US, Johnson Johnson has its own antiviral vaccine that is called Janssen US vaccine. Covishield Covaxin. Covishield is produced by Serum Institute of India. Covaxin is manufactured by Bharat Biotech India. These two vaccines are presently available in our country. And the Sputnik vaccine from Russia, our government has approved to use Sputnik vaccine in India, and Sinovac, that is available in China. These are the important vaccines. Apart from that, other countries, even UK and US, they are trying to produce a more effective vaccine and a safety vaccine which is going to control COVID-19 infection 100%. But in these available vaccines, 90% safety, because we have practically lost all the healthcare workers, frontline workers got vaccinated 2 doses. In this healthcare workers, only less than 5% people got again COVID infections, second infection. In that 5%, they have mild symptoms with no complications. They have mild symptoms and record very fast. 5% people. The vaccinated people, less than 0.01% cases have mortality rate. Mortality in the sense like a sudden, even after vaccination, second day, third day, fourth day, they have developed massive thrombosis in the brain, sinus vein, splanchnic vein, cardiac coronary artery, deep vein, pulmonary artery, pulmonary vein, and as well cardiac thrombosis. Due to acute massive cardiac thrombosis, less than 0.001% patient died due to massive thrombotic burden after receiving COVID-19 vaccination, because the number is negligible, but these vaccines are protecting 90%. The 90% complications are protected by only vaccines. Dear friends and viewers, keep it in mind, we have the only available options: wearing the mask properly and avoiding unnecessary travel outside, and getting vaccinated immediately as early as possible, as soon as possible. Very important. The vaccine related complications, as I said before, after vaccination, patient may develop fever. 48% of the people may experience feel fever, low grade fever, and 43% may feel headache along with fever, and myalgia, muscle pain, fatigue, joint pain. 22 to 23% may develop, and some 16% of the people may develop nausea, vomiting after vaccination. And the vaccine induces thrombotic thrombocytopenia due to platelet factor 4 activity. This is a VIT, that is called vaccine induced thrombotic thrombocytopenia, is a common cause for sudden death after vaccination. Thrombus in cerebral sinus and venous splanchnic vein is very common after vaccination. As I said before, the percentage is 0.001%. So no need to panic. But in this panic moment, this 0.001% mortality is negligible. But our duty, our priority to save all the public and to prevent them by immunizing in the first way. And Pfizer vaccines, everyone should take N biotech vaccine 2 shots. The period gap between the first and the second dose 21 days. And this vaccine at presently approved for more than 60 years old male and female. Moderna vaccine should be taken two shots apart 28 days. The age bar is more than 18 years. Janssen vaccine, one shot is sufficient and which is prescribed only for more than 80 years old male and female. Covishield, two shots, gap between the two shots should be minimum 28 days and patient can be taken after 18 years of age. Like Covaxin, two shots should be taken and the gap